Welcome back to Rural Health Today and our latest series, Rural Health Fractured. In this series, we're discussing how rural health is being fractured in nearly every direction by the politicization of health and science, the decline of resources for rural communities, deterioration of adequate insurance coverage, and so much more. As we take a closer look at the fault lines in our healthcare system, our guests will provide a new perspective on how healthcare leaders can navigate these challenges and explore sustainable solutions. Now, I am thrilled to be in the studio today with, for her first time on our podcast, it's great to have you, a very special guest. So Monica McConkey is an expert, a specialist in rural mental health, and founder of Eyes on the Horizon Consulting, which I am so excited to learn more about in just a few minutes. Monica, first of all, tell us a little bit about your role regarding the work that you're doing as the owner and I would assume the operator of Eyes on the Horizon Consulting. And why did you choose the field?
Oh, good question. It's been a journey to get here. So I, grew up on a farm in rural northwest Minnesota. The closest town
Okay.
to us had 98 people. So I am
No way.
rural to
Wow.
the core. Yes.
Oh, wow.
Same farm that my great grandparents and grandparents farmed. And so that's really the starting point for
Sure.
rural. Grew up there, got degrees in psychology and counseling, and then went to work really all 31 years of my career in rural communities. So from doing direct service mental health work to being an administrator for a variety of mental health programs from inpatient, psychiatric hospitalization to outpatient, kind of your general uh, program that is very accessible. So that's my history. And in 2019, I had the opportunity to go into private practice and really focus in on mental health and agriculture. So my work now, I do direct service work with farmers, ranchers, and their family members, as well as lots of speaking and training around rural mental health topics with a specialization in mental health and agriculture. So that's kind of where I'm at now, and
Yeah.
yeah, how I got here was a lot of open doors, a lot of closed doors, but definitely that rural thread has
Yeah.
been with me through it all.
So, Monica, in terms of the passion that it's obvious that you have for rural, because we share that in common. Why don't you give our listeners a little insight about you as a person? Maybe an interesting fact. We like to humanize our guest. It's like it's not just someone that owns a company that's talking about the services that they do, but humanize yourself to our listeners across the country. Maybe a fun fact, a noble item about yourself.
Oh, I have a fun fact. I was 1987 Minnesota milking shorthorn queen. I, I was. We were in 4-H,
And
and
that
we
is what?
so through 4-H we showed a breed of cattle called milking
Okay,
shorthorns. They're a dairy breed of cattle. There are
I
shorthorn
see.
beef cattle, but these were milking shorthorn dairy cattle. And so, yeah, through years of showing and connections, I got to wear the crown and the sash and
Oh
hand out
my
the ribbons
goodness.
and represent the organization. So, yeah, fun little
Oh
fact
my
there.
goodness. Well, you're really milking that for all it's worth. But hey, on that note, we'll move right along. It's really neat to know though that we come from similar backgrounds as rural community members. We know what the farm life is like. We know what 4-H is like. Going to the county
Yeah.
fair to show animals,
Yep.
right? That is a way of life, and
Yes.
today across this country, that way of life is being threatened,
Uh-huh.
and it's being threatened in many, many areas. And as we look at social determinants of health and the
Uh-huh.
challenges around access to care, whether it's mental health services or physical health services, a lot of deserts that are happening across this country.
Absolutely.
And obviously, you're trying to fit, a piece of this puzzle back together to try to bring sustainability to communities
Mhm.
where mental health services are greatly needed. So I'm excited because today we're going to be talking about mental health access. We're going to be talking about access to mental health care in general, and how it applies to rural communities. I'm excited that Monica's here to share her perspective as a leader in rural mental health. We'll talk about the service closures that we are all hearing about and even facing in our respective communities, how stigma affects care,
Mhm.
and of course, what all of this has to do with rural health. So, why don't you start by telling us, Monica, a little bit about Eyes on Horizon Consulting? When it started, why it was formed, what is the mission today, what is the work that you're doing?
I really started building it 10 years ago, 2016, as we were getting more and more reports about farmer suicide deaths in throughout the country. Uh, and my mission, really, through creating this organization, this business, was how do we reduce stigma and increase access to mental health services in our rural communities? And that has, opened up a lot of really incredible doors for me to have conversations with people like you, who are also in that fight,
Hmm.
and adopt that mission for their organizations.
Hmm. So, the thought process for starting such a huge undertaking was to advocate, correct,
Yep.
and to
Yes,
be a voice.
it was, and it was really to expand knowledge and discussions around behavioral health in our ag communities.
Yeah,
Because as you know, rural communities, there's often a lot of stigma, and the open communication around mental health does not happen. And
right.
that, of course, leads to ongoing issues. So, yeah, really to have those conversations, engage people, support people in whatever ways I'm capable.
And is this a non for profit? Are you a 501c3? Is this, do you
For
go out
profit,
and for
for
profit
profit. Yep.
and you consult? Can you give us an example of like who's your main contact? What when you go to a community, who are you working with?
Oh, goodness, it varies. I have gone to communities and worked with public health.
Okay.
I have worked with agricultural organizations, from your local grain elevator, your co ops, to extension. I do a lot of work with extension. Uh, the broader, like, state Department of Human Services,
Oh, sure,
suicide
sure.
prevention programming,
Yeah.
um,
And
departments of
and so
agriculture.
yeah, you're bringing teams together to try to find some solutions to these serious problems. And the
Right.
problems, though, I think you would have to agree, always revolve around funding
Uh-huh.
cuts and funding crisis, right? So
Yes.
as you know, around this country right now, under the HR1, the big beautiful bill, it's called,
Uh-huh.
services in communities like Hillsdale and throughout this country are going to be gutted. In
Okay.
those community services are community benefit services, whether it's OBGYN services, psych services. What we typically
Right.
find is that hospitals, rural hospitals, when faced with budgetary constraints, will look at their profit margins
Yep.
of certain programs and they have to make decisions. How long do we
Yep.
want to stay open? What programs are costing the community, a
Yep.
hospital? What is the revenue generation and what is the loss?
Yes.
And if it's not a break even, is it a community benefit? If it's a community benefit, at what cost to the organization
Uh-huh.
itself, but impact to the community? And so
Uh-huh.
oftentimes on the chopping block are mental health services
Yes.
because in hospitals like mine, where I have a 10-bed unit, it is not a revenue generator. In fact, it
Right.
is a cost center. And so, what we have found that when rural hospitals or health systems themselves experience financial challenges, the behavioral health unit is often the number one service that's most likely closed.
Right.
It's at risk. And so, I want to ask you, why is this the case, and what impact does it have on rural communities when, in fact, a behavioral health service unit does close or services are divested?
Yeah, good question. And you touched on kind of the root of that. A couple of things. Reimbursement rates are lower in behavioral health typically
They are.
when we look at medical services. Also, outcomes in behavioral health are tough to measure. They're difficult to measure. How do we measure that someone is not as depressed? Like, what's the outcome? Are they being more
Yeah.
productive at work? Are they parenting better? How do you measure that? And so when we look at services tied to outcomes, that's also tough for behavioral health because we have our scales, we have our screenings, we have tools we can use, but really different than being able to look at blood pressure, for example, or lab results, or, it's just, it's a bit more abstract.
Yeah.
So that I feel like is a hindrance. If we could have really good outcomes and show impact, that would make a difference. But so much of the impact is prevention
It is
and
prevention.
early intervention, which is
Yep.
really hard to measure.
It really is.
And then, overall, when you look at rural communities, behavioral health staff, difficult to recruit and retain.
Yeah.
They are often drawn to, more urban settings for a variety of reasons. But that adds to the burden of a healthcare system.
It does. It really does. One of the challenges we face here is when you can't recruit or retain talent in those areas. The service line is also divested. And
Yeah.
right now we're really challenged with, at times, finding the workforce necessary to keep
Yeah.
the beds filled that we need to fill in order to
Sure.
reach at least a break even. So many
Right.
challenges in
Right.
access. As we learn, different states have different funding mechanisms for community mental health. Some CMHs are competitive in nature with for-profit and
Right.
non-for-profit. Some are strictly a division right of the state. The state covers the majority of it,
Right.
has contracts with hospitals like mine. But all of that's going to be interrupted very soon. Under HR 1, the reimbursement, majority of this population that we find are Medicaid populations in rural communities because 70% of our payer mix is Medicaid and Medicare. So
Right.
let's say that we can get through the funding crisis, which is going to be difficult.
Right.
It really is. The next issue that we face, which is a broader issue, is something that we have fought for years, which is the stigma around receiving mental health care services or delivering those services in communities. And what I want to focus on is the work that you've done in agricultural communities. Because I was alarmed after I heard about our interview today and doing some research about the suicide rates among our farmers. And I'm going, why does that exist? I mean, we're being
Right.
told that this is, God's country. It's peaceful. It's the land. It's you're one in with nature.
Right.
It's you own it's your operation. But right now, I guess I'm going to ask the question about the stigma around mental health. Make delivering that care a little more difficult, maybe, or challenging in agricultural communities. And tell us about the mindset toward mental health itself and the healthcare services often found in these communities.
Yeah, huge barrier in rural, because in rural, we know that we are not anonymous. People know us, they know our families, they know where we live, they know what we do for a living. They often have known
Yeah.
our parents and grandparents. So when we are struggling with a mental health issue and there's this stigma out there, it drives people to remain quiet, not seek help, push it down, which of course that isolation exacerbates the condition.
Right.
In our rural communities, especially among the agricultural population, there is a lot of stoicism. They are a very self-reliant population because
Yeah.
really they've had to be over the years. No one's coming
had to
to
be.
save us. We have to figure this out. We can't afford
Right.
to have
Right.
people come in and solve our problems for us. So that has led to this belief that seeking help equates to weakness,
Yeah.
which of course we know it does not. Because
It
if
does not.
they had a chronic disease issue, I mean, sometimes it's hard enough to get them into the doctor for medical care, but
Yeah.
much more receptive to seeking help for a physical medical issue than a mental health issue, because there's this belief that I should be able to change it, I should be able to control it. Nobody else can fix it for me.
Right.
And so a lot of my work is around engaging people in understanding that you have no problem calling someone in to help with your livestock or your crops. Like if you're noticing something's not right and your livelihood is dependent upon it, you're going to call that nutritionist, agronomist, veterinarian, soil health person, and you are going to work with them to find a solution.
Right.
No different than I'm feeling stressed, my relationships are falling apart, I find myself coping in ways that aren't healthy. I need those tools from someone who can guide me through what to do.
Yeah.
So I find it helpful to have those conversations and really parallel that we're asking for help all the time in one form or another. And so let's really look at why is that different with mental health. I also feel like we are making gains in our rural communities because of conversations like this. A lot of organizations are adopting the message that it's okay to talk openly about mental health and suicide, especially a business types of organizations. I mean, we're all
Yeah.
talking
Yeah.
about it. That makes stigma reduce.
Yeah. So currently, resources that would be available in rural communities, though, are oftentimes on the chopping block. So,
Yes.
so if someone was looking for those services, Monica, I mean, at the end of the day, let's say I'm the rancher, I'm the farmer. Let's talk about, when does intervention take place? And I guess at the second question that I would have for you is, where can that person go? Where would you recommend? So if a rancher's listening today and saying, I'm really struggling,
Yep.
let's give them some immediate direction, and then we're going to talk to the industry in a minute.
Yep.
But I want to talk to the patient right now, to the individual. What can we say to them today?
Yeah. I would say, even if you're thinking about, should I call somebody or shouldn't I, just do it. Like, if you're having the thought, just get a hold of somebody. Every state has something a little bit different. I'm in Minnesota. I'm legislatively funded to provide counseling services to farmers and ranchers, cost them nothing, no insurance billed. It's really remarkable. Other states have voucher systems, so every state does something a little bit different. One really great tool that you can look up is the National Farm Bureau has created a listserv, and it's called Farm State of Mind. And you can search by state, and they have collected mental health resources from each state. Some are private practice counselors, some are like extension programs. So that's a place to start. Look at your state on that Farm Bureau, Farm State of Mind website,
Okay.
and you can find providers. Another tool is through SAMHSA, the Substance Abuse Mental Health Services Administration, SAMHSA.
And we're going to put these in the show notes, by the way. So we're
Perfect.
just taking
Perfect.
notes now, but we'll get those in the show notes.
Perfect. So SAMHSA has a provider locator for substance use, for mental health, for both. You can go on, you can search in your location, and it'll show options. So there are definitely tools out there to guide you to make the call.
Absolutely.
Many states also have farm helplines that you can call 24/7. 988, of course, always available. The
Okay.
Suicide and Crisis Lifeline to call, text,
Yeah.
or chat with.
Yeah, absolutely. So regardless if you feel there's a barrier with insurance or costs, these programs come to you, and there'll be no charge to you in most states. Those resources are always free when you make the phone call.
Yep.
Don't worry about ability to pay at this time.
Okay.
It's get the services that you need right now. Talk to somebody. All right, let's shift gears a little bit and talk about the industry, because right now there's workforce shortages that we alluded to earlier,
Mm-hmm.
but healthcare professionals do not, at least in rural communities that I've experienced, do not seem to be gravitating towards rural America.
Mm-hmm.
It's very difficult for me to find a psychiatrist today. In fact, I'm
Yes.
contracting with telepsychiatry
Yes.
because you can't get anybody physically to come here. We're also finding that individuals are not seeking positions in therapy services, and
Mm-hmm.
we're finding a decline in at least in rural communities that I serve. So tell me what the industry is doing today. What are you seeing on a national basis? Is the industry looking up? Is it a challenge right now? What would you suggest to someone who wants to enter a career pathway of this?
Definitely a challenge for all the reasons you talked about. Often our mental health providers are paid based on productivity. So when you're in a rural setting, uh, that's tough because you don't have the population density to maybe
Yeah,
support a practice. People have to travel long distances. Your cancellation rates are higher. All of that impacts people being
yes,
drawn to rural. And of course, we have higher, you mentioned this before, higher rates of medical assistance versus private insurance. So the pay differential is great. Um, there are, of course, the programs out there that will, excuse me, excuse me,
you're fine.
reimburse for working in an underserved area. So, out of college, if you are looking at tuition reimbursement, there are definitely options out there to look at rural as a place to go. Another thing, when I'm talking to younger adults who are just getting started in their career, I really sell rural. Like, you become the ability for you to become a champion in that community is great. Like, you are going to go, you will be featured in the newspaper, you will probably be asked to speak at civic organizations. You are a known entity in that community. So your ability to build relationships and make an impact is felt very differently than in a bigger system in a larger
Yeah,
metro area. Great
yeah,
place to raise kids. The
right.
opportunities are living, cost of living is lower. Lots of opportunities that we in rural need to not be shy about
That's
selling.
right.
Like,
That's right.
let's promote the
Promote
goodness
it.
of being in rural. Yes. To
That's
draw
right.
people in. Yeah.
That's right. So one of the, I had a healthcare professional reach out to me, and I met with them, and the question was, how do I build trust in this community? They were
Mm-hmm.
from a community in another county over, and
Mm-hmm.
that issue of trust really plays a big role in mental health services. So
Yep.
what advice would you give to a practitioner, someone listening today that's thinking, you know what, I want to go into a community, but I need to build trust. How do they build that trust? Because one of the things that I suggested to this individual was, well, you can't be in the shadows.
Yes.
You have to be up front and present. So what advice would you give to that person?
Really along those same lines, attend events, make yourself known, join, volunteer, join organizations, find a church that fits you and your
Yeah.
family, really be out there and do a lot of listening. Like, tell me about this community, tell me the history, get to know the history of the community and be
Yeah.
listening to the people. Get your name out there, uh, do the newspaper interviews, jump on the little local radio show, um,
Right.
because it is in rural, it is all about relationships. Another thing that's important, I think, for rural mental health providers is assuring confidentiality. So if you're a part of the community, and this happens to me all the time, I'm meeting with people that sometimes I grew up with, or I
Yeah.
I grew up with their parents, or they're a short tail cousin because they don't have the luxury of finding other providers. And so assuring confidentiality in rural is really an important aspect. So you want to lead with that. Another thing too is to consider a co-located space. Like, can you have an office in the clinic? or in the chiropractor's office, or so that you are not the standalone mental health agency that people are going to know every vehicle that's parked in front of you.
Absolutely.
And so how can you co-locate? How can you consider telehealth? I know that's not an answer for everybody.
Right.
Can you consider in-home work, going to the patient versus the patient coming to you? So I think all of those we need to keep an open mind to when we're talking about rural.
All great ideas, great suggestions. And we need a talent pipeline that we need to
Yes.
build in this profession. And so if you're listening today, reach out to your local colleges, speak with your local mental health
Wonderful.
professionals. You will find that many of them may even sponsor you, as we
Sure.
do, to become healthcare professionals. So it's a great opportunity. All right, we're going to transition the conversation into our last major topic, which is really going to focus on what we would call the continuum of care.
Okay.
So currently, right now, we've had silos and segments and mental health services. We think, all right, that's relinquished to, Department of Health and Human Services. It's a contract, but it's more than that. We all have
Yep.
to own it.
Yep.
We can't just say the hospital controls healthcare for your physical health, and that this organization. We have this continuum. So I want to ask you a question that communities are trying to figure out right now. You said it earlier, early prevention, early detection, early prevention, early intervention, all those things can save lives, create good pathways for long sustainable living. So how can we integrate mental health with other health and social services to work towards that full continuum that I just spoke about in these rural communities? Because there are so many, and maybe you'll disagree, Monica, there's so many silos. How do we break the silos? How do we come together?
Absolutely, there are silos. And some of the things that I've found to be helpful, I mean, any level of collaboration is helpful. And that's really got to be the rule of thumb in rural. It's got to be about collaborative effort instead of anybody trying to do it on their own. So even things like common screening tools. Can we all get on the same page that we're doing the same type of screening tools,
Yep.
utilizing the same screening tools? Are we meeting collaboratively to share opportunities um, to what's the word I'm looking for? Apply for grant
Apply for it.
funding
Yep.
together as a community versus an organization. Are there referral pathways? So do we know what each other is doing? And do we know what would exclude someone from receiving that service? So really clear referral pathways. And I think a big one too is how can we reduce barriers to sharing PHI? We're
Absolutely.
not going to be all on the same electronic health record. So, what are some policies and procedures that can be in place community wide between providers, social services, healthcare, mental health care, that reduce that barrier and help us to really be able to communicate with each other so we're treating the whole person?
Absolutely.
There's a lot of models out there, collaborative care model, patient-centered medical home model, where there's co-location on different levels, from being fully embedded to, you know what, I'm just renting an office space here from you. And I think in
Absolutely.
rural, that's key. That is absolutely key to providing really great holistic health care.
Absolutely. Outreach, collaboration, communication. You'll find that once that's made, we all must work together, and we're going to find an opportunity really to get that patient, the individual, through the process quicker. It's not going to be as cumbersome. And then the synergies that we're going to have by doing that is because then you can refer them. You might identify that there is a physical barrier,
Yes.
and vice versa. And so, great opportunity to collaborate, much needed, especially in light of what we're facing in the approaching months and years with the reduction of reimbursement to rural communities.
Right.
Services like this may be going away. And
Right.
so I would encourage our communities to look at new collaborative ways to
Sure.
engage with organizations like yours, with companies like yours,
Yep.
Monica, and have the conversation about how do we lead discussion groups? How do we find resources since we have to cut out a certain segment of our service line?
Right.
How do we replace those in these rural communities? I think there's going to be a lot of
Uh,
challenges for our rural hospitals moving forward as it relates to
Absolutely.
mental health services.
Yeah.
Let
Agreed.
me ask you this. Do you have a success story, a favorite, like,
Oh
something you worked with,
gosh.
a company maybe you worked with,
Mhm.
a hospital, an organization, or even an individual story about where you realized, like, we're really making a difference? Maybe it's
Yeah.
moved to metrics, something of that nature.
One, uh, I have a lot of them. I have a lot of really great examples of how people have come together in a collaborative model in rural communities to bring in knowledge of mental health. Like one, I think of very rural North Dakota, the a small city said, you know what, we want you to come in and do both a suicide prevention training and just help us understand mental health. And we had all city employees from the road crew, or as county employees from the road crew to
Yeah,
child
yeah,
protection to the auditor, all
that's incredible.
sitting there having this conversation.
That had to feel
Oh, it's
awesome.
so good, so good.
Yeah,
Other things that we've done is we have met with healthcare systems.
yeah,
So, Mayo in southern Minnesota, the system in St. Cloud, Minnesota, Centricare, and have really worked with them to make shared referral pathways really simple. So they know our program, they know what we do, they know if there's a farmer sitting in the office, they can call me either for consultation or for direct service. So it really comes down to communication, even with our bigger systems. We've had
yeah.
some programs where we have the medical team go out to a farm to look at equipment. So when
Hmm.
somebody is coming in to the ER with trauma, they know exactly what happened. Like they can picture the
Yeah.
auger, they can picture the
Oh,
PTO, they
yeah.
know the grain
Yeah.
bin. So it's really this crossover of we've just got to be talking to each other. We've got to break down silos. We've got to know what each other does,
Yeah.
and how does one piece of frustration for patients is I got referred here, I went there,
Right.
and then they told me I
And
didn't
couldn't get the
qualify for
services.
services.
Oh, yeah.
And so
Oh,
we've
yeah.
got to know what the exclusionary criteria is. So collaborative meetings, constant
Yes.
communication, new programming there needs to be an
Yeah.
education around that with other providers.
Yeah. And a follow up to that, Monica, do you do any advocacy work at your state or federal level to advocate for these type of services and funding?
Definitely
How
on
does
the
that look
state
for you? And
level.
and what?
Yeah.
Okay.
I
And what would you suggest to your professionals out there listening? What they should do to advocate?
Don't be afraid to jump in. I go down probably every other year typically because we're on an every 2 year budget um, cycle in Minnesota. So I go down and testify before typically it's the House or Senate ag finance committees, and just talking about the gap in rural and the numbers that really reflect that gap. I mean, suicide rates in rural across the country are higher,
Yeah.
as well as chronic disease. I mean, the numbers are there to support the having the conversation. And so, don't be afraid to reach out to your legislators individually and or get involved in an organization to do some testifying. It feels daunting when you're thinking about it, but when you're sitting there with those people, they are people just like you are. And many of them are coming from these rural communities. They're representing the rural communities, so they really need to hear the voices of
Absolutely.
what the experience is.
Absolutely. Great advice, great suggestion. Advocate, advocate,
Mhm.
advocate, because if you're not at the table, we find that oftentimes we're on the menu. And so
Mhm.
you've got to make sure that you are at the table having those discussions.
Yeah,
We could talk for a very long time. We're going to put your contact information in the show
perfect.
notes. You will work with all individuals
Yep.
throughout the country, correct?
Correct.
You're not just restrictive to your state. And so
Correct.
if you're listening today and you want to learn more, you want to duplicate some type of services like this or be
Mhm.
a powerhouse like Monica's and her communities, please feel free to reach out to her. Her information will be in the show notes. And before we
Yes.
conclude today, we always do a segment with our guests called Rural Health Recommendations.
Mhm.
And you've been doing this now for quite some time, and you're an expert in your field. You have certainly a depth of information and very knowledgeable
Correct.
in the particular service area of mental health services, community engagement, and those things. So what we like to do is take the pieces of wisdom that
Uh-huh.
you've learned over the years and give a recommendation to some of our new leaders who are listening to this podcast. Like, it's a tumultuous time right now.
Yeah.
I mean, there are a lot of things going on federally, statewide, in their local community,
Right.
funding issues, reimbursement issues,
Right.
labor force, tariffs, supply chain, the list goes on and on.
Oh.
And so what sage advice, what piece of information would you give to a young aspiring leader, maybe someone who's just at the crossroads today, who's challenged by all of these pressures? What advice would you give today?
You know, when we talk about rural, it absolutely is all about collaboration and relationship building and out of the box thinking to survive, to keep our services
survive.
alive.
Yep.
And so you can't stay within the walls of your organization.
Nope.
Get out in the community, talk with other community leaders, talk with the natural helpers in your community, the ministers, the teachers, the people that the community goes to naturally,
Right.
and build relationships. You know, how
Build
can
them.
we have those voices be a part of our services? Meeting people where they are, absolutely necessary.
Great advice. Meet people where they are. That's critically important. Don't stay in the silos. Go outside, advocate, and reach out to your community to be engaged. Great advice, Monica. It's been great talking to you
Yeah, you
today. It's
too.
been great to have you on the podcast. Would love to be able to interview you in the future
Mhm.
and see how your projects are moving along if we could.
Absolutely. Thanks for having me.
Absolutely. And thanks to our listeners for tuning into Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcasts. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com. And make sure you've subscribed to the show so you never miss an episode. Until next time, remember, Rural Health Strong.